Okay, so I check my doctor's orders. I gather my materials.
Come in.
Okay. Hi, my name is Rachel, and I'm going to be your student nurse today, and I'm going to be doing a full physical assessment on you, okay?
Okay.
Okay, just let me go wash my hands and provide you privacy, and I'll be right back. Okay. Can you verify your name and your birthday for me, please?
Laura Dillon, 9/23/96.
Thank you. And do you have any allergies I need to be aware of?
No.
Nothing, not to latex or medications? Okay. Check that with my orders. Okay. And then got my stuff. Okay, I would raise your bed. And good. So what's going to happen first is I already took her health history and I did the vital signs on her, which are her pulse, respirations, her temperature, her O2 stats, blood pressure, and then I also assessed her height and weight. And then now we are going to notice, I'm going to examine her, and I'm going to see that since she has been able to talk to me and her eyes are open and blinking, she is conscious and she looks to be having a nice skin tone. She doesn't look blue, which would be bad. Can you tell me where you are?
I am at your house.
Yes, you are. And what are you doing here today?
I'm getting a physical assessment.
A physical assessment. Great. And can you tell me what date it is?
2/24/16.
16. Okay, great. I'm going to have you grip my fingers, please.
Okay.
Great. Okay, her grip was very strong and bilateral. I'm going to have you point your toes into a ballerina. Nice. And then pull back for me. Awesome. Okay. Looks good. I'm going to assess your facial nerve, okay? By doing so, I'm going to take this cool little Q-tip and I'm going to rub it against your face and you're going to tell me if it was the sharp side or the dull side, okay? Close your eyes, please.
Dull. Sure. Dull.
Wonderful. Okay. So that was her facial cranial nerve. Okay. I'm going to have you sit up for me, please, so I can assess your other cranial nerves.
Okay.
Okay. I'm going to assess your olfactory nerve by having you... You going to sit up, right? Okay. I'm going to have you close your eyes, and then I'm going to waft a smell underneath your nose, and you're going to tell me what it is, okay?
Okay. Chocolate.
Okay. Lovely. Okay. Now I'm going to assess your scalp, okay? But first I'm going to look at it and make sure that the hygiene is good and make sure that there's no infestations that are leaping out of her scalp. I'm going to check for dandruff and for gray hairs. And, okay, look for some, yeah, that's good. Okay, so now I'm going to apply my gloves. And now I'm going to inspect your scalp by palpating. Feel for any lumps, bumps, bruises. This is when I'll be checking for lice to see if they have any eggs in there. Making sure it looks healthy and the scalp is on nice and doesn't look extremely dry or red or agitated. Don't have to mess her hair up so bad. Okay, lovely. Okay, so her hair is good, nice, and now I would assess her eyes. Her face looks symmetrical. She has nice brown eyes. I don't see any pink or crusting. I'm going to touch your face now, okay? Please look up. Okay, her sclera is nice and pink. Good to go. Conjunctiva is nice and pink. All veiny, lovely. Look down for me so I can see your lids. Okay, there's no lesions on them. Okay, now I'm going to take this pen light and I'm going to assess your dilation, okay? So look at my shoulder, please. Okay, lovely. Very nice. Okay, now I'm going to measure them. Okay, she has about a 5. Okay, very nice. I'm going to, if I had one, I would take my erythroscope and I'm going to simulate checking for her Yep. Okay, so now I'm going to take my ophthalmoscope and I'm going to assess your fundus, okay? You're going to see a bright light. I don't want you looking directly into the light. Just look straight ahead, okay? Okay. Okay, very nice. It's a nice orangish red color. Okay, nice and healthy in both eyes. Love it. Okay, so I have just assessed her optic nerves, and now I'm going to do her ocular motor nerves. Follow my finger, please. Okay, lovely. Tell me when you see my fingers.
No.
Okay. Okay, so that was her ocular motor, her trochlear, and her her just trochlear. And now I'm going to have you scrunch your face all up and do a big smile for me. Okay, now stick your tongue out and wiggle it all around. There you go. Love it. Okay, so now I'm going to inspect your nose. Okay, can you tilt your head back for me? Okay, by doing this, I'm going to look and make sure there's no deviated septum. Can you plug one nose and breathe in? Okay, now do the other. Thank you. Good airflow through both nostrils. Now I'm going to have you open your mouth, nice and wide. Stick your tongue out and say ah. Ah. Okay, so her uvula is midline, and it looks like she has her tonsils. And her mouth is not dry. She has a nice pink tongue. Can you tell me what your dental hygienist schedule is?
Brush my teeth twice a day.
Okay, awesome. When was the last time you had a dental exam?
December.
Okay, good. Now I'm going to look in your ears. I'm going to feel her auricle. Do you have any pain in your ears? Okay, so you're going to feel a slight tug. Okay, her tympanic membrane is nice and grayish. Okay, lovely. Not too much wax in there to block anything. Now I'm going to do a whisper test on you, okay? Now I'm going to whisper a word behind you. You tell me what it is.
Summer. Winter.
Good job.
I liked the first one.
You like the first one? Not the second one?
Mm-hmm.
Okay. Okay, so your ears are all done. Now I'm going to assess your sinuses. Do you have any tenderness in your sinuses right now? Do you have a congestion or anything?
Mm-mm.
Okay, lovely. Okay, now I'm going to look at your neck. I'm going to palpate for all of your lymph nodes first. Do you have any swelling or feel any different?
Mm-mm.
Okay, now I'm going to feel for her thyroid, see if it's enlarged. It's not. Okay, so I'm going to put my hands on your neck and I'm going to have you swallow, okay? Swallow for me. I know it's difficult. Okay. Okay, now I'm going to have you shrug your shoulders. Lovely. Okay, so now I'm going to look at her skin, see if it looks all hydrated, and it does. I'm going to assess to make sure it's a nice temperature throughout. She has a very nice temperature. I don't see any lesions or discolorment. She does have tattoos. Now I'm going to assess her refill. Okay, less than 3 seconds in her fingers. You can see your toes. Same thing. I'm going to check for edema. No pitting edema that I see. And it does scrunch in, so non-pitting is not an issue either. Now I'm going to look and make sure that she looks clean and her fingers and toes were not clubbed. Now I'm going to assess your lungs, okay? But first, I'm going to look and make sure that her chest is rising symmetrically. She doesn't have any scars to show that she had any lung surgeries done. Okay, can you stand for me, please? Okay, so first I'm going to push your hair back.
Okay.
And I'm going to listen to your trachea first, okay? And then I'm going to listen to your bronchial, vesicular, and then your vesicular regions, okay? I'm going to listen to make sure that there are no adventitious breath sounds and that it's nice and clear and equal, okay? Breathe in. Okay. Bronchial. 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 Bronchial vesicular. Bronchial vesicular. Bronchial vesicular. Bronchial vesicular. 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 Okay, turn around for me, please. They were both equal and bilateral in both sections that I checked. Now I'm going to do the same for the back, but I want to make sure not to hit any of the bones because you can't really hear sound through bones. Breathe in and out. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Beautiful. Okay. Now what I'm going to do is I'm going to percuss, make sure I hear resonance in each section. Lovely. Okay, now I'm going to place my hands on your back, and then I'm going to have you take a deep breath. Okay, one more time. Lovely. Okay, do you have any history of smoking? Okay. What's going to happen is I'm going to place my hands on your back and I'm going to have you say 99 so that I can feel the vibrations in your lungs, okay?
Okay.
Go for it.
99.
Again?
99.
Again?
99.
Again?
99.
Okay. And now there's also another way to do it. I'm going to listen to you say it in your lungs now, okay?
Okay.
When you feel me place my stethoscope down, tell me, okay?
99.
Okay.
99.
Okay.
99.
One more time.
99.
Okay. Beautiful. Okay. I didn't hear any wheezing or bronchi or crackles in your lungs, which is lovely. Now I'm going to have you lay down so that I can inspect your heart.
Okay.
Not you, cameraman. Okay. So, as I said before, her chest is rising and falling symmetrically. So there's no lag in the heart.
Oh, no.
Okay, so first I'm going to assess her aortic, which is located at the second intercostal space, right sternal border, which is right about here. Lovely. Okay, now I'm going to go to the pulmonic, which is the second intercostal space, left sternal border. Okay, and now I'm going to go to the Erb's point, which is the third intercostal space, left sternal border. Okay, and now I'm going to go to the tricuspid.
Sorry, guys.
Which is the fourth intercostal space, left sternal border. Okay, and now I'm going to go to the mitral, which is the fifth intercostal space, mid-clavicle line. Okay, you also hear S1 the loudest at the apex of the heart, and you hear PMI and the apical pulse. You hear S2 loudest at the aortic. Okay, so now that I've done that, I'm going to assess her pulses. You do them both bilaterally except for your carotids, because you don't want to cut off circulation to her head. That would be bad. So we start with the temporal, nice and strong, and now we go on to the carotids. And while you're at the carotids, you want to listen for the brutes. Okay, nice and clear. I already did the apical when I was listening to the heart. So now I'm going to move on to the brachials. Like I said, bilaterally. Wonderful. Now we're going to do the radials.
I'm sorry.
And the ulnars. Lovely. Okay, and then we would do the femoral, which you don't need to see, just know that I did, on both sides. Okay. And now we're going to do the popliteal. Nice. Then we go on to the posterior tibial, whichever way you want to say it. And then the dorsal pedis, which is between the big toe and the middle toe. Lovely, nice and strong. Okay, I am all done. Do you need anything else before I leave?
No.
Okay, so I'm going to lower her bed back down. I'm going to raise her rails, give her her call bell, and then I will go wash my hands and document.